Thank you, Dr. Neha Kakar and Sahani sir. Good evening, good afternoon, and good morning. This is the 1359th day of continuous webinar conducted by International Forum for Promoting Homeopathy. We welcome all to this session, and today our guest is Dr. VRUXA RAIYANI MEHTA. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic lovers, doctors, and students. And we have 3 sessions in a row. 7 to 8, we have our Hindi session. 8 to 9, we have our international session in English. And 9 to 10, local language session in Malayalam. And we have an excellent guest of today. She is a professor, VRUXA RAIYANI MEHTA. She has completed her MD and having more than 15 years of clinical practice as well as teaching practice. And she is the HOD and professor, Department of Epilepsy, Sri V.G. Garia Homeopathic Medical College, Rajkot, Gujarat. And she, doctor has worked in different hospitals and having very good exposure to homeopathic practice, and is a very lovely teacher among students and one of the respected teacher among students also. And she has presented the sessions, this paper on this leucoderma at the Delhi sessions some 2 years back. And we are very happy to have such a person into this session. And doctor will be talking about the efficacy of Hahnemannyan system of medicine in management of leucoderma. We welcome you. Welcome, Dr. VRUXA Mehta, to this session. Welcome, madam.
Thank you, Dr. Dhaneshwar. Good morning, good afternoon, and good evening, IFPH team. And thank you so much for inviting me for the 1359 of this event. First of all, thank you to Dr. Dhaneshwar, and thank you so much, Dr. Sahani sir, for all these things. And I'm really grateful towards all of your team efforts and everything. Myself is Dr. VRUXA RAIYANI MEHTA. I'm professor and HOD in a FMT department in a VG Garaya Homeopathy Medical College. And I'm a homeopathy consultant. I'm owner of Life Care Homeopathy Clinic since 15 years. So I have a teaching plus clinical both more than 15 years of experience. Today I'm blessed because of Sahani sir. I saw the Sahani sir is present, and this case I was presented in Mumbai, Delhi, leucoderma for this leucoderma patient, and fortunately Sahani sir is my moderator, and he guided me so nicely what to be seen in this case, what is the right thing. So today I'm so thankful to see the Amrudul Sahani sir here. Right now, I'm start my session.
Yes, everything fine.
Yes.
Yes, we can see.
Okay, sir. The role of homeopathy in a vitiligo, role of homeopathy in a leucoderma. What is a vitiligo first? So vitiligo is an autoimmune condition where the skin loses its natural color and develops the white or light skin colored patches. In this condition, there is either destruction of skin pigment or there is some defect in a production of skin pigmentation leading to the loss of normal skin color. Vitiligo is a main disease, which this disease is not an autoimmune disease. This disease is might because of the social stigma disease. तो हम vitiligo को social stigma disease भी बोल सकते हैं because of if you see the patient of vitiligo, the social stigma start. I share one point in my first slide. My one of assistant has a vitiligo in a leg. My one patient came to my clinic for another treatment, and he guided my assistant. What happens is it because of burn? Is it because of this thing? What happens is that, and actually he asked so many questions, and being my female assistant, my patient went from the clinic, and he see little bit the nervous and cry. I felt, what happened to you? And she said, "Okay, ma'am, this patient asked me a lot of questions. So vitiligo is not an autoimmune disease, but vitiligo might because of the social stigma disease. It is not a disease where the skin lose its natural color. This disease causes a lots of the emotion-based disease. So today I choose this topic. My next thing is how many people are affected from this? It affects around 0.5 to 1% of world population. As high 8.8 prevalence have been reported in India, where the considerable stigma is attached to the disease. Vitiligo patches can appear anywhere on the skin, but commonly affected sites include the area around the orifice, genitals, any exposed areas such as the face and hands, the hair, and rarely the eyes also may be affected. 50% of cases appear before the age of 20, with the disfigurement resulting in a psychic morbidity in a 60 to 35% of those affected. 60 to 35%. 50% of cases appear before the age of 20. The teenage start, and it might be this problem is start because you see the graph of the patient almost before 20, most of affected, and this age so much puberty changes happen, and also this causes so much emotional imbalance, and that reflects what reflects this. It reflects that depression, sleep disturbance, suicidal thoughts, suicidal attempts, difficulties in a relationship, and avoidance of social situation have been reported in an individual affected by the vitiligo before adulthood. So that this is not because of only and only autoimmune condition, but that disease affects on a mind level. That disease affects so much on a mental level. After appearing of this disease, patients might be going in a disturbance, might be going in a depression, or not a depression, but that ultimately leads to the suicidal thoughts, suicidal attempts, difficulty in a relationship. I saw 2, 3 patients in my career. Ma'am, my engagement happened, and then certain this spot of vitiligo happened to my body, and my engagement broken. And this problem start, difficulty in a relationship, and that difficulty and that causes suicidal thoughts, and ultimately it reach to the suicidal attempts also. So in this condition, every individual has a different. Now we see the types of vitiligo. There are mostly the 6 type of vitiligo. First is a generalized. This is most common type, and patch is formed on a different parts of the body. I see lots of patients mainly on a generalized vitiligo. Second is a segmental. In this type, the smooth white patches appear only on one side of body. It means a segmental part. Third, it's a mucosal. The mucous membrane is affected with this type of vitiligo. In my 15 years, which means a very less experience in a homeopathy, but I saw that the mucosal type of vitiligo, it is hardly to cure because when the mucous membrane is attached with the skin and the skin patches appear, at that time there is a very, very, very difficult to cure. Focal. A rare type of patches are formed on only one area and do not spread after 1 or 2 years. very settled. It is a settled type of pages, not increase, not decrease, very attached with the body. Just like fifth one is a trichome. This is a rare condition where the skin texture ranges from the light pigment to colorless white spots. And sixth is a universal, wherein more than 80% of the skin is infected with the vitiligo, and that is a next to impossible for the cure for me and my clinical practice. Now we discuss the how many causes of vitiligo. So there are the three main causes for a vitiligo. One is a autoimmunity. Second one is a genetic transmission, and third one is a hormonal imbalance. We will discuss right now about this thing first. Why this thing we discuss here? Because this thing will help in find out the medicine and how to plan the treatment of vitiligo. So first is an autoimmune condition. It is an autoimmune condition. It means when your immune system disturbed and that happens. Or whenever the immune system disturbed and your immune system is variant, at that time homeopathy works so nicely because homeopathy believes that the health between the mind, body, and soul, and that homeopathy medicines can work so nicely upon the autoimmune disease. Second is the genetic transmission. Our day-to-day life and our social life talks about that कि ये तो हिंदी में बोलते हैं इसको ये तो कोड है ये तो दाग है ये तो 7 पीढ़ी तक चलेगा. So it is this genetic transmission, according to the layman language, it transferred to the seventh generation. It's a very rarest thing. But the social stigma behind this, and that is the reason there are so much depression, there are so much disturbance in a relationship, and there are so much suicidal thoughts present in that type of the patient because social stigma is so much higher in this type. Third one is the hormonal imbalance. We show in our past slide what we saw. Mostly it happened before the age of 20. Before the age of 20, and so much hormonal changes happen in our body during the puberty time. So it might be one causes of vitiligo is a hormonal imbalance. Next slide. Vitiligo can be effectively cured by the various medication and treatment therapies available under the vast scope of homeopathy. Here I am discussing only one. Homeopathy cures vitiligo by providing a personalized treatment after considering the patient's past medical report, the nature and spread of vitiligo, affected body area. Environmental factors are also responsible. Environmental factors are also responsible for this condition. Why? We discuss during the I will guide. I will see one good case and the treatment plan of this patient's case. I will guide that point is why environmental factors are responsible. It helps in treating every individual's vitiligo problem differently and gives the special empathy to each patient. In this case, patient required empathy. It gives adequate time and treated with the proper cure. Vitiligo can be easily fixed by flexible treatment and homeopathy. Vitiligo can be treated in its early stage. Medicine is given after assessing the patient's symptoms, especially his mental state. For example, if someone has white spot on the lips, nose, genital, some homeopathy medicines are very beneficial if taken for a long time. It is a skin disease, so only homeopathy can cure the vitiligo effectively. Since homeopathy medicines have no side effects, so along with it, patients must some precautions to get relief from the disease. The patient is asked to maintain a daily routine along with the medication. Also, along with the counseling is also done for the patient's mental condition. so that he does not go into depression, stress, and can avoid a big trouble. So there is a two treatment plan according to homeopathy. We should give a constitutional medicine according to the patient's history, origin, duration, progress, or according to their environmental factors, according to the disease condition. And the second one, that type of patients, doctor require a special counseling so achieve a good uh, we can achieve a good mental health of patient also. This one is one of my case of vitiligo. This case I am presenting here because this is the case they gave us so much goosebumps for a homeopathy. Why? Because certain times I felt that the homeopathy really works. After a certain period of time, how homeopathy can do the miracle? And this is not a homeopathy. This is not my case. This is a homeopathy which can do a marvelous miracle. Homeopathy medicines and homeopathy can doctor do anything. This is the case. We will give idea about that. So case, this is personal because this is the online case taking. So whenever I do the online case taking, I'm sending a one type of form to my patient, and then I will take a history. The patient name is a Kajol Patel. Age is a 39. Sex female. Occupation, she is a management. This one is the address, patient phone number. Chief complaint is vitiligo. Origin start from the March 2020. We all know about the March 2020. It's the COVID time. Origin of cold. At the time, a little pigment on the back. Then causative factors, stress and allergens. Patient write down in a causative factor about the stress. Then I have to ask what is your menstrual? Write down the menstrual history. Normally, we give the IVF for my daughter who is a 3 months normal. नॉर्मल डिलीवरी उनकी नॉर्मल डिलीवरी के साथ एक बेटी है जो we did with the IVF. Now, next, what do you do in your in your stress condition? He told there's yoga and breathing exercise. What is your cycle? Sleeping cycle. I'm always asking the sleep to evaluate the patient's condition because I'm feeling that sleeping is a subconscious mind process, So patient speaks wrong, patient speak lie with a conscious mind, but the sleep is a subconscious mind. So the dreams and sleep never speak alike. And what do you do? What is your dream during COVID? Stress is dead about what happened with my daughter. Unko sleep, dreams, death, and COVID happened with their daughter. These all things fine in your dreams. You see the anxiety of mind. And patients write down the positive factor, the stress. Trust, nothing specific. Food, Italian, Mexican, and Indian, bread and rice. Any other disease or past history? Yes. In 2007, I had through depression. Patient didn't write about the past history, but patient have a certain, the trauma with the relationship, and she had a depression in 2007 because of one-sided relation. Family history: mom diabetes, dad thyroid, and blood pressure. Yes. Location: skin in face, sensation, whitish discoloration in patches of face. Modalities: not specific any concomitants. Past history is very important. In short history of depression on allopathic medication for a short period of time. She's an investment banker and management studies. By 2007, she passed through the very bad depression and she took allopathy medication because of one-sided relationship. She told me, but I didn't route certain things in a case. In 2007, IVF treatment done and had healthy baby after a successful treatment. I mentioned this IVF history. Why? Because this leucoderma might be vitiligo might be happen after the IVF. No, there is a long duration. In 2020, occurrence of vitiligo, and I had taken a homeopathic case on 18th October 21. This day, I write down in the prescription family history of father hypertension, IHB, mother diabetes, mellitus. Now, personal history of patient. Accommodation is good, economic state is sound, diet and food habits increase but is really satisfied. Hobbies, listening music alone. Vaccination done as per schedule. Lifespace investigation, birth and early development, all the milestones were achieved normally. Behavior during the childhood, very calm nature. Education, bachelor in finance. Occupation history, investment banker. Marital history, normal. Children 1, female. Travel history, not specific. Gynecological and obstetric history. Normal we did IVF for my daughter who is in 3, otherwise normal. The delivery is normal, but the baby come out to this world with the IVF process. She has a normal cycle, full done, normal delivery was done. A case of vitiligo, appearance of patient, leaf thin, test, Italian, Mexican, Indian bread and rice. Thus increase, stool hard and black color, urine burning while urination, acrid, sweat profuse even on a slight exertion, slips down, thermal reaction chill, mental journal, which is most important because we have to prescribe the constitutional medicines. A train of thought keeps going on in my mind. I'm always in my thought, up to an extent. Don't even sometimes get to know what is going on in surrounding. I get lost in thoughts of mind while walking to someone and easily get confused in taking a decision, even though she is an independent woman. I'm very affectionate and sympathy for a people. I can't see anyone suffering. I easily get angry, but never express my anger. The person due to whom I am angry because I feel if I will fight that person, they would something which would cause harm to my dignity, which I can't tolerate. I don't like everyone surrounding me. I like to sit with myself and retrospect to my own self. In 2007, she had a depression. Now it's a case processing. I have to take a 3 mental elements from anger and transfer with the silent grief and indignation, absorbed because she can't express her angerness. She dissolved his angerness, she absorbs her anger. So I took a absorbed confusion of mind and difficult concentration while talking. Affectionate. Physical general thirst increase for the large quantity. Appetite easily getting satisfied. Profuse perspiration, even on a slightest exertion. Urine burning and acrid. Hard and black color stool. Physical particular white patches on a face. Mostly the face. I will see the patient's photo, so you can see easily the patches, more patches on a face, right? So I took that time. Miasmatic evolution, Sura psychosyphilitic. This is my repertorization. And the first repertorization, first medicine came in my repertorization at that time, a natramure, second is the arsenic, and third is the phosphorus. And now I am confused between the natramure and phosphorus, not in a arsenic. Why? Because I'm explaining now. Sorry. So I'm little bit confused at this time between the natramure and phosphorus. So which one I choose? That is the most important. And 1 minute. I saw this slide. This is the before treatment. And this is the after treatment. I'm very confused to choose natramine and phosphorus. Please write down all of you which one is good for according to you after seeing this case. Yes, yes, yes. Why not phosphorus? Yes, this is a simple case with the simple medication, with the simple prescription of natramine. On the basis of reported result and the materia medica knowledge, I'm not prescribing the natramure on basis of only the repertorization. I'm prescribing the natramure on basis of materia medica because natramure is the very good medicine to absorb the thing. Why? Because natramure, which is prepared from the salt, which salt? So it is a sea salt, where it formed. It is formed in a sea. And what is the role of sea in a nature? She can absorb everything. If you throw the bottle, then he can absorb. If you don't, if you whatever you throw in a sea can easily absorb the things. Whether it is a very good, whether it is a very bad. You can see that if you see the pearl, which is very, precious pearl, you find from the sea. And you can also find the certain plastic, certain garbage, and certain bad things from the sea. So sea has a lot of capacity to absorb the things. Sea can absorb so nicely everything. And the natramure is prepared from the sea salt. That is a one materia point. It's called, according to us, it comes under the doctrine of signature. And during my clinical practice, I always focus in these two main things because I'm always believing nature never speak wrong and sleep never speak wrong because sleep present our subconscious mind and nature always gifted by God. So it never speak a lie. So I'm always believing in the doctrine of signature for the certain things. We see the doctrine of signature in a sanguinaria. We see the doctrine of signature in a pulsatile and everything. But we never see so much doctrine of change signature present in a natramure. But I see in that type of patient because this case is not only, I treated not only the vitiligo in this case, but I'm also treating with vitiligo, I treated infertility also. That thing you will see in a next testimony, patient's testimony video. During this process, one day patients called me and patient asked me, "Okay, ma'am, may I go for a IVF treatment?" I asked why. Because the 2017, right now it's 2021. My one daughter it is almost a 4-year old. And my first daughter came from the IVF process. So I will go for IVF and I need a second baby. What should I do? And I simply asked the patient, do you have any hurry about this process? She told, why ma'am you asked that type of the strange question to me? And I told my patient, okay, if I choose a correct medicine for your vitiligo treatment, that might be help in your infertility journey. So please wait for a 6 month. After 6 months, I will permit you for a IVF. Because during the IVF, there are a certain hormonal injectable, which almost flare up the leucoderma treatment also. So might be I am confused because of homeopathy aggravation. कि पेशेंट को होम्योपैथी एग्रावेशन आ गया या पेशेंट को ट्रीटमेंट में कुछ चला गया या आईवीएफ से हुआ, कुछ पता नहीं चलेगा. So I told my patient कि please wait for a 6 month. And she's a good patient, always Netamura, a little bit obedient patients. So she wait for a 6 month. And during this process, what happens? This is the effects of homeopathy. There are the 18th October 2021 patient case paper. Hi Dr. Mehta, please let me know. उसी दिन उन्होंने मुझे पूछा था, thank you doctor, I do have a doctor appointment tomorrow. At the same time, I can try to do earlier tomorrow if you are able. ये process के बाद I will go for a video consultation, and for this video consultation, patient asked my permission कि मेरी एक और अपॉइंटमेंट है और उस दिन उसकी गायनेक की अपॉइंटमेंट थी और पेशेंट ने मुझे पूछा था कि व्हाट विल डू, एंड देन आई विल talk my patient कि please wait for a 6 month. Hi Dr. Mehta, please let me know if you have a few minutes to talk this week. Once again, thank you so much. We are over the moon and praying everything goes well the next 7 weeks. Hi, how are you? What is the health? Hello, bad morning sickness all the days, but doing okay. Haven't been applying the oils because it has been cold and cloud. Because I'm suggesting the coconut oil to apply in a leucoderma and vitiligo cases. No sun for a few weeks. Have my first appointment next week. I'm also giving the advice to patient to, after applying the coconut, you have to take a little bit sun rays because calcium and vitamin D3 has a good role to make our skin. Please let me know the medicines and what is them, so I can tell my doctor here, and thank you. Yes, sure. And this miracle of homeopathy I saw in my clinical practice. Hi, Dr. Viti Mehta. Wanted to send an update picture of Divya. We are so thankful every day that you came to in our lives. That is a patient testimony.
I wasn't really positive about whether I would get my pigment back. So we had a consultation. Hi, my name is Kajal Patel, and this is a testimonial for Dr. Mehta in my journey with her the last few years. I was introduced to Dr. Mehta a few years ago because I was looking for some assistance for my face. I had gotten vitiligo during the onset of the pandemic. I had tried some things on my own, started getting a little bit pigment back, but it wasn't at the pace I would have liked. And I wasn't really positive about whether I would get my pigment back. So we had a consultation over the phone, over WhatsApp, as she's in India and I'm in the States. And we talked about, the possibility of me being able to get my full pigment back, which was the first time I even heard someone give me that positive reinforcement that I needed to hear, which was really nice to hear. She talked about some different deficiencies that I could potentially have that may have caused it from stress or allergic reaction. In the consultation, we also talked about my family history, talked about my family. I had, mentioned the desire to grow my family, but my daughter at the time that I had was through IVF, and I didn't want to go through that process again to grow my family. I was at a much higher maternal age and didn't think I would be able to have additional children on my own. So she sent me some medication, told me, great instructions on what to do. And then she said something that I kind of laughed in my head about. And was very skeptical. She said, well, if you take this, we're going to help you get your pigment back on your face. And then in 3 months, you're going to be pregnant. So I had the medication. I was very skeptical because I went through IVF. I went through 4 or 5 years of trying to start a family. And IVF was the only route for me to have an additional child. So I started the medication very skeptical about pregnancy, but I was really excited to get the journey started to cure my vitiligo. After taking the medication for 1 month, to my surprise, I was pregnant. And it was truly a shock. Once again, I was very skeptical. But because of Dr. Mehta, she gave us our second blessing in our family and really completed our family. We're still doing ongoing treatments now for my vitiligo. So anyone that is looking to look at a different type of medication, what homeopathic, I highly recommend it, highly urge it. I understand that it's not the conventional way of medicine, but it truly does work. And like I said, Dr. Mehta completed our family and we're forever grateful.
Yes, I saw the lot of question in a chat box. I will go with this question also, but this is a conclusion. First, this case shows the positive role of homeopathy treatment in a vitiligo. It re-established the importance of individualized homeopathy treatment based on a holistic basis. It also opens the path of further studies to be done to explore the scope of homeopathy in this type of disease condition. Homeopathy is able to give a wonderful and miracle cures in many cases of vitiligo. In many cases of vitiligo, I don't told during this testimony, I never speak like that. This is my cure case. This is a treatment is going through this patient, and I have seen this patient only the 6 months. I saw the before and after cases in which the patient having a light pigmentation. I'm not speaking about that cure that patient of vitiligo, but this I presented this case because this is the miracle of homeopathy. This homeopathy, which is found, which is invented by the Dr. Hahnemann for the good treatment. In a fourth aphorism, write down, he's like a preserver of health. So that is a preserver of health. If we treat the vitiligo, we work as like a skin specialist according to the modern medicine, but associated with the skin specialist, we work too much good in a gynec and obs department. If we choose the correct medicine, then we will reach the constitutional treatment, and it will help in a associated complaint and concomitant complaint too. I'm not prescribing so much new drugs here. I'm only here, big platform. I'm only serving the Natramure case. This Natramure, which we studied in a second year. So I have a humble request to all the students who, I'm not speaking anything to seniors, but all the students who hear me right now, okay, please focus on your second, third, and final journey. Because in a second year and first year, 50 medicine is almost too good to control so many diseases. This is not a certain students. I'm a teacher also. So certain college students ask me during, मैम क्या होम्योपैथी ट्रीटमेंट बोल रहे हो, बुखार का पेशेंट आएगा क्या करेंगे बताओ, कितनी तो बुखार की मेडिसिन है, आप देखो फीवर की रेपर्टरी है, कितनी सर्च करेंगे मैडम, उससे अच्छा है ना डोलो लेके अच्छे हो जाए. He spoke like that, sir. Or I have a very good contact with my students, and they spoke like that, ma'am. तो मैं बोलती हूँ एक काम करो, अच्छा है ना, अगर एक्सपोजर टू ड्राई नॉर्थ वेस्ट विंड, मेरी कॉलेज राजकोट से 25 किलोमीटर अवे है. मैं बोलती हूँ अगर आप बाइक में आते हो दिसंबर जनवरी में और आपको ठंड लग गई और दोपहर को बहुत बुखार आ गया और फ्रेंड को बोला जल्दी दवा ला, जल्दी मुझे कुछ हो जाएगा, बस इट्स द परफेक्ट ailment from exposure to dry northwest wind, and you are so much anxious about your disease. मुझे कुछ हो जाएगा, predict to something happen with med, you should start a Econite. You don't think so much. If you see the 3 LN keynote, you can choose a medicine. That is a perfect. vitiligo का case, infertility का case, I am not speaking about any new medication. मैं भी यूज करती हूँ, ऐसा नहीं है, लेकिन आई एम सिंपली गिविंग एग्जाम्पल ऑफ नेट्रोम्यूर कैन डू मिरेकल. Why? Because C is the best part of nature. So nature always has to give a very good result. So we think like that. We have to teach our students, we have to teach our juniors. A simple medication can do miracles. Simple medication can cure the vitiligo. Simple medication can cure the infertility also. If you see this slide, this is my after treatment. You can see this patch, and this one. Here the vitiligo is present. I am not presenting the cure case of vitiligo. I am presenting here the progressive good result case of vitiligo. And during this my journey to treat the vitiligo, I am choosing what I am choosing. So I am choosing this thing. I'm choosing the simple thing with the repertorial aspect and materia medica aspect, Netromure 200 single dose stat orally. Seclec follow-up for a 1 month patient feels better and slightest skin improvement seen. So I'm prescribed same treatment has been followed by for next 2 months. So I'm prescribing Netromure 200 every month, single dose, nothing else. So this simple medication give a good result, and then simple medication can do miracle with the homeopathy. So we teach our students just like this. After I'm not, I'm not presenting the further case, but right now I'm giving these patients to one miasmatic treatment also, because the patient have grew through the Sura psychosyphilitic and tuberculate. The syphilitic miasm is more prominent in a female. So I'm giving a carcinosin 1M. This patient has an intercurrent. Why I'm choosing this medication? Not because of syphilis. I'm not choosing a syphilis. Why? Because this lady, see the journey of patient. I always pick in that thing. Vitiligo can appear depression, sleep disturbance, suicidal thoughts, suicidal attempt, difficulty in relationship, and avoidance of social situation. This thing happened with this patient. Not patient. This patient has also depression, but this depression is not a vitiligo. I'm correcting my prescription with the base of history. पेशेंट को विटिलिगो हुआ, उससे पहले डिप्रेशन नहीं आया था. पेशेंट को डिप्रेशन आया था एट व्हाट टाइम? तो पेशेंट हैड सफर फ्रॉम डिप्रेशन इन 2007 because of on allopathy medication. Depression is so much high, even though she is a very independent woman and the workaholic, too much workaholic. Then that is the reason I am prescribing carcinosis 1M, and my case is right now running, and this is the result. Miracles of homeopathy. You see the patient, you see the testimony, and thank you so much. Now I am ready to give you answer.
Yes. Yes, Dr. VRUXA RAYANI ma'am, it's really an excellent session indeed. And you have shown the beauty of homeopathy, not simply treating the disease, but we treat the patient, not the disease. And whatever things are there in the patient will be corrected, even though the patient may not be reporting at the time of consultation, but the patient may feel that, oh, I can tell these, my rheumatic arthritis next time when I after this treatment of vitiligo, like that. So that's the reason why the patient is not talking about those infertility, secondary infertility. But once your medicine corrected everything, since it being a constitutional medicine, that works wonderfully. And as a result, you see, being a firm believer of homeopathy, you stood on with your case, and that really resulted in curing the patient. That's the beauty of homeopathy, as you rightly point out. And of course, the case taking is very, very important. And not only the case taking, but you catch the key words from the patient, and that really works here. Anyway, this is the beauty of homeopathy. As you rightly pointed out, we can have such so many cures from such cases. Anyway, those who want to participate in this discussion, or those who want to have a question with our guest, you may raise your hand so that we will allow you to unmute yourself and speak to the Professor Dr. VRUXA Mehta. Usually, what kind of potency you choose as a doctor? Because this being a mentally, you choose the mental symptoms rather than physical symptoms, then you go just only 200 potency. In all cases, you prefer this 200 potency, or whether you go for 6 or 1 or like that.
Sir, I'm choosing a potency on behalf of this. Also, I'm going with organ on I'm choosing a potency on behalf of susceptibility to the patient. But in a vitiligo cases where the mental symptoms are so much good, I'm going with the medium potency. So for me, I'm going with the 200.
Exactly, exactly. And there are
Yes.
persons who thought that, who may think like that, oh, this being a skin case, and if I give this medicine, sometimes it may aggravate. So let us go for zero L potency, and we can repeat it like that.
Yes, sir, you are right. But I'm very okay with the 200, and I got a very good result with the 200 potency in my 15 years of clinical journey. So mostly not for a vitiligo, but all type of the chronic disease, where the
Yeah.
mental symptoms are so much higher. At that time, I'm choosing a 200 potency first because I'm always believing in a nature and homeopathy. I have to connect the nature with the homeopathy. So I'm mostly going through the patient's mental state first, and I'm trying to elaborate and try to get a more mental symptoms. That is my first choice of consulting during my case taking. So I will 90 to 95% of cases I will go with the 200 in a chronic disease if I felt that okay, my medicine is correct on a repertorial aspects and my materia medica knowledge.
Exactly. That is what experience will make you a better person. That's the reason why you stood on with your prescription. I know Dr. Nigam from Pune used to prescribe only 30 potency. What will be Dr. Poonam? No, Dr. Amar Nigam. You may be knowing Dr. Amar Nigam,
Yes, sir.
uh, a famous homeopath from Pune. He used to give only 30 potency, whatever be the disease, but only single dose, and he will wait. Uh, that's so
That's real.
according to him, 30
That's so
potency,
good.
and 30 potency is not a small potency; it's a very, very big potency, like that. So.
Yes, yes, sir. I'm okay with a 30 also. During the acute case, I'm always going with a 30.
As whether you are practicing in your private clinic, or you are getting patients in the hospital.
No, sir. I have a private clinic since 15
Yes,
years.
I have seen that only the last part, but I couldn't add to this session in our poster, because I have tried to add, but by the time it is about to begin the session, so that's why we couldn't add that things. Anyway, our button, Dr. Ram Paresh sir is waiting. Yes, sir.
Thank you, Dr. Dhanesh ji. Congratulations Dr. VRUXA Mehta.
Thank you, sir.
Very thanks. Excellent session and presentation. Case is beautiful.
Thank you,
According
sir. Thank you so much, sir.
Leucoderma is a very difficult case, or always leucoderma treatment is a low potency, 230 potency. An
Yes,
angle
sir.
of treatment. There are many angle of treatment. First angle, symptomological angle, is the best treatment. According to symptomological angle, treatment is a acute disease, and miasmatical angle, curative way of treatment, and pathological angle, very difficult treatment. So natrum is a very nice, beautiful medicine for leucoderma.
Yes,
Many
sir.
kinds of leucoderma deals natramil remedy. 200 potency is the very suitable potency for natramil. Very thanks, Dr. Mehta ji.
Thank you,
Again,
sir. Thank you.
dynamic lectures. Thank you.
Thank you. Thank you,
Uh,
sir. Thank you,
n-
everyone.
Now I invite Dr. Bob Lim from Malaysia to have a chat, as well as you can give the vote of thanks to our guest of Dr. Bob Lim. Yes. Yes. Network problem. Is there any network? There seem to be a network problem. Hello. Yes, you may stop the video and then talk, Dr. Bob Lim, so that we are not getting. Your network is very low now. Anyway, we are very happy to have such a nice session from our professor, Dr. Happened, Dr. has also left. VRUXA Mehta. We are congratulating you for your excellent session. And with that, we come to the end of the day. We are very thankful to those who attended the session and those who commented on the session, as well as those who gave messages to the questions asked by Dr. Samantha. With that, we come to the end of the day 1359. And tomorrow we will have a session from Dr. Guru Kiran, and Doctor will be talking about the subject is Topsis agria, garden aristocrat. That will be the subject to be discussed tomorrow. It is over to Dr. Maria Majon to moderate the Malayalam session now. Thank you all. Good night.